It's a passcode for attendees.
Interesting. Okay, she says it's asking her for one, so maybe.
I would recommend her to click the stream link in the program, and then I can always promote her to panelist if need be.
Okay.
All right. Hello, everybody. I am your host for today. My name is Dr. Brianna Beaupre. I'm an assistant professor at Wichita State, and I'm also a board member of CrimCon. And welcome to our first conference, virtual. We're happy to have you here. So just some ground rules. We're proceeding in the order of the program. Each presenter will have 10 minutes on the dot. And when you have questions, please type them in the Q&A box. And so this is what it should look like on your end as attendees. So we're just asking questions in the Q&A. There's no chat or raising hand function available. And just remember to have fun. And yes, I can, Jason. Cool. Awesome. So I'm going to turn it over to the first panelist. I'm going to stop sharing my screen so then you can share yours.
Ed, did we get that? There we go.
So presenters, please keep an eye on the chat. I'll give you a 1-minute warning and you're welcome to proceed whenever you're ready.
Okay. Can everybody hear me now? Okay. So we're talking today about an analysis we did of emergency department admissions for child sexual abuse in the United States from 2010 to 2016. Okay. Emergency departments have an important role in child and adolescent sexual abuse. They're on the front lines for many cases. They provide the initial response, provide immediate medical care. They can conduct forensic medical examinations if the abuse is recent, and they may be the first to identify child and adolescent sexual abuse in cases with other presenting complaints. Yet data on ED admissions for child and adolescent sexual abuse are sparse. We had an opportunity to use a data set on emergency department admissions to study the role of child adolescent sexual abuse in emergency departments and the frequency of admissions for child and adolescent sexual abuse. We did a secondary data analysis of data from the nationwide emergency department sample of the Healthcare Cost and Utilization Project. This sample included 20% of hospital-based EDs and represented more than 3/4 of all ED admissions in the United States, with the date range being from January 2010 to December of 2016. We created a dichotomous child sexual abuse variable based on the International Classification of Disease, ICD diagnosis codes. We calculated the number of ED admissions for child sexual abuse by year. And then using census data, we calculated the rate per 100,000 children. Okay, next slide. in summary, just a brief summary of the results, we saw an increase in child and adolescent ED admissions for sexual abuse during those years, and an especially large increase in admissions, in adolescent admissions for sexual abuse. This figure shows the increase overall for age 0 to 17, and we see an increase of around 5,000 in 2010, up to close to 9,000 in 2016, and a rate that increased substantially from 6.93 to 11.97. When we look specifically at adolescents, we saw even a steeper increase, an increase from over 2,000 in 2010 to 5,000 in 2016, with an increase in rate from 8.02 per 100,000 to 20.2 per 100,000. Much of the overall increase among all child and adolescents was due to victims, an increased number of victims aged 12 to 17. In 2010, adolescents were less than half of the sample, but in 2016, they were more than half, 15.7%. This was exploratory research. We don't have a lot of data to explain this increase. Possible explanations may increase greater detection of sex trafficking victims, and the United Nations report shows an increase in detection of sex trafficking victims, including in the United States, and greater social and professional awareness and sensitivity regarding sexual assault. This is really a starting point for research, but it suggests a trend that really should be studied further. Thank you. Here's my email address, and this is we published this research in the JAMA Pediatrics, in a journal of the American Medical Association, and we'd be happy to provide a copy to anyone who's interested and emails us. Thank you.
Excellent, thank you. Next panelist. And also, oh yeah, if you can stop sharing, the next person can.
Okay.
Thank you.
All right, I'm ready when you are, Bree.
Got it. You can go whenever you're ready.
All right, good morning, everyone. My name is Dr. Ingrid Johnson. I'm a professor at the University of Alaska Anchorage Justice Center, and I'm here to share some preliminary research results on behalf of myself and my colleagues, Randi, Breager, and Katie TePas with the Alaska Department of Public Safety. So this is part of a very large research project that we've been working on under the Alaska Sexual Assault Kit Initiative, which is a federally funded project by the Bureau of Justice Assistance. So we're collecting a lot of data from a lot of different sources, but the two questions, and we have a lot of research questions, but the two we're going to focus on in this presentation are: what is the range of victim survivors' perceptions of justice, and how common are those perceptions of and experiences with justice? So I'm going to be presenting data from two different data sources. So the first was a set of 26 semi-structured qualitative interviews that I did with victim survivors who had reported an adult sexual assault to the Alaska State Troopers between 2006 and 2016. So in these interviews, we asked them about their process of reporting the sexual assault to the troopers and everything that unfolded afterwards with their case in the criminal justice system. So everything from victim advocacy and support through prosecution, if that happened, the trial, and everything afterward. The second half of the interview focused on their perceptions of justice, whether they thought justice was done in their case, and whether they had any recommendations for improvement. We then used those findings. So that was done in 2019. And then we used the findings from the interviews as well as from other qualitative literature on justice for victims to do a quantitative survey in early 2020. And so for the quantitative survey, we were interested then in measuring actually how common some of these experiences and perceptions were. So we had a sample of 117 actual valid responses. And for this one, we ended up broadening the sample. So this one was open to anyone who had experienced an adult sexual assault in Alaska. And so they could be people who reported to the police or not, and reported to the troopers or not, if they did report to a different law enforcement agency. And I'm not going to go into the details, but as anticipated, they were predominantly women in both samples. And we had pretty good racial and ethnic and age variation, especially considering the demographics of Alaska. So to measure perceptions of justice in the interviews, we simply asked them what justice meant to them, and they were able to elaborate, and we had a bit of a conversation about that. In the surveys, because we wanted a quantitative measure, and as far as we knew, this has not yet been measured quantitatively, we had a few different ways of trying to look at not only how important certain kinds of justice were for victim survivors, but also how they prioritized those different types of justice. So we created a list of 24 different definitions of justice. So these were very short little blurbs, and those again came from the interviews and other qualitative research. And we presented the people in the who took the survey with that list of justice outcomes. And we asked them, how important is each definition to you? And they could select very important, moderately important, or not at all important. So after they went through that process, they were re-presented with every justice definition that they had marked as very important. And they were asked which of those, which three of those were the most important to them. And they were asked to select one type of justice as their most important type of justice, 2 as their second, and 3 as their third most important. Finally, to measure how common experiences with justice outcomes were, we presented them with the full list again and asked them how, whether each type of justice was achieved for them after they were sexually assaulted. So I have a very big table here that I'm not going to go into a lot of detail right now, but basically because this was the first, again, that we know of attempt to measure this quantitatively, we came up with a few different ways of sort of looking at top justice priorities for the survey sample. And so you can see there's 3 columns, and you can see a sampling here of some of the definitions of justice. So those 3 columns were just sort of different ways of trying to decide which types of justice were the most important. And you can see the 3 at the top, compassionate treatment, healing, and prevention of sexual assault, came up in the top priorities, no matter how we tried to measure how important these different definitions were. So I'm just going to elaborate a little bit on those 3: compassionate treatment, healing, and prevention. So compassionate treatment was really about compassionate treatment from professionals in the criminal justice system. And so during the interviews, it came out that this was pretty important, a pretty important type of justice, that they just wanted to be treated like a human being. And so I replaced all of my research participants' names with the names of famous female feminists. So in this exchange with Emmeline, she says, yeah, not feeling like just another rape case. I felt like they had no emotion for people in my situation. They say Alaska's #1 for sexual assault cases. And when I look back on it, that's how I felt like I was treated. And I asked her, like another number? And she said, yeah. And you can see in the pie chart on the left side of the screen that about 38 or 39% did not feel like they received compassionate treatment. And then only about 1/3 did feel like they received compassionate treatment after they experienced a sexual assault. Healing was another really important outcome, just this idea that people who've experienced sexual assault should be able to heal, whether that's through criminal justice services or whether it's through their own therapy on their own time, or just their own self-care and resiliency. And so This is a really great quote from Tirana to capture that. She says, "He didn't go on to hurt anybody else, and I healed, and I learned, and I became who I am now, and I'm still badass." I mean, what can we really feel all that bad about the past if we're okay with who we are now? Am I really going to think about, beating this dead horse over and over again? Or am I going to move on just being badass? And you can see, which this is kind of a positive finding on the right in the pie chart, that 53% of the survey participants felt that healing was achieved for them after they were sexually assaulted. And so while that is promising, it's still just barely over 50%. So that means we're looking at a significant number of victim survivors who have not experienced that healing at the time of completing the survey. And then, finally, sorry, glitches. Prevention, and this came out really strongly in the interviews, and that's why we chose to name the presentation "Ending the Cycle as Violence," is that in a number of different ways, victim survivors in the interviews expressed that whether it was the perpetrator who had harmed them or whether it was just other perpetrators out there in the world, they just didn't want anybody else to experience sexual assault, and that was really important to them. And so in the survey, it sort of bore this out where it came up in the top 3 as far as what victim survivors conceive as justice is preventing sexual assault from happening. And so this quote from Cheryl reads, "Justice for me would be that he'd never hurt anybody ever again, and he could get help. I mean, he needs a lot of help, not just help for myself, it's help for the perpetrator." And that also came out really strongly in the interviews where when they talked about what should happen to the perpetrator, often it was framed around this idea of prevention. So they didn't care often if it was through treatment or incarceration or whatever it was. They just wanted that perpetrator to not go on and harm anyone else, and then the widespread prevention. So this type of justice translated a little awkwardly into the survey structure of asking, was this achieved for you? So was prevention achieved is sort of, I think most participants just took that to, I guess we don't know exactly how they interpret it, but we can see that 56% said no, prevention has not been achieved or was not achieved for them. So we can see that a large number of the victim survivors who participated in this survey do not feel like prevention is being done or has been done for them in the state of Alaska. So that's all for our presentation. I have plenty more to talk about if there are questions. Thank you.
Great, thank you. So yeah, anybody can ask questions in the Q&A, so feel free. Sometimes it takes a minute to type out the questions, so I'll give it a little bit. So we have a question to Dr. Johnson. Do you think your survey measure of perceptions of justice would apply to victims of other types of crimes?
Yeah, I do. Some of them were very specific to sexual assault. So one thing, especially because this is part of the Sexual Assault Kit Initiative, one big question is, testing all kits. And so the SACI funding that's happening across the country is because kits weren't getting tested. And so there were some questions in the justice definitions, like one of them was just the processing of sexual assault kits. And so some of them were very specific to sexual assault cases, but a lot of them are pretty general justice outcomes that could apply to victims of other types of crime. And like I say, I use some of them from the qualitative literature, and some of that's been done with victims kind of broadly, and some of it's been done with victims of sexual assault or intimate partner violence. So it definitely could translate out to other types of victims.
Great. Our next question is, I'm curious whether participants in your study felt towards sentence length as being related to being heard or being valued.
I didn't ask about sentence length. I asked about just incarceration in general. And so I haven't actually started playing with, I guess, sort of some of the relationships between the different justice outcomes. What is very interesting is that retribution came out, no one put it in their top 3 priorities. And it came out pretty low on the other ways of sort of prioritizing the justice outcomes. And so again, I think just to go back to the interviews and give context to that, is a lot of them, some of them had extremely horrendous experiences and they felt a lot of animosity towards their perpetrators, but that was in the interviews a minority. And for the most part, they were just framing whatever happened to the perpetrator as that preventative sort of hope. So they were just saying, whether he needs to be locked up for a long time, whether he needs treatment, whatever it is, we just want this to be deterrent and preventive. It's early.
No worries. Great. Dr. Cross, how many types of adolescent abuse did your data measure?
Well, we use the International Classification of Disease codes for child sexual abuse, and I'm not sure I can break it down any further than that. Jason, do you have? Can you answer that?
So it was just a child sexual abuse codes. We have some other papers that we're working on, looking at other forms of abuse and physical abuse. And there's some challenges there. In 2015, ED's transitioned from ICD-9 to ICD-10. So there are some challenges around that. Sexual abuse is one of the codes that translates very well from 9 to 10. But for this paper, it was just the sexual abuse, but there are other variables in the data set around different forms of abuse. I'm not sure if that fully answered the question.
I did not ask the question, but it sounded like it did. Any other questions from attendees? Dr. Johnson, do you think victim survivors' perspectives of justice differ from justice professionals' perspectives? Good question.
Well, that is a great question, because the part of the data, some of the data that is not being presented here, is I also did semi-structured qualitative interviews with 40 criminal justice professionals. So everyone from victim advocates, troopers, sexual assault nurse examiners, to judges, district attorneys, public defenders, VPSOs. I think I'm missing, those are village public safety officers unique to Alaska. So I did interview them, and it was sort of the flip side of the interview structure that I did with the victim survivors. So it was asking them generally what the process looks like from the start to finish, and then what justice meant to them, whether they thought justice was being done in sexual assault cases, and their recommendations for improvement. So while I don't have quantitative data, I do have those 40 interviews. And I would say, one of the things that came out of those interviews a lot is they would say, well, I guess first and foremost, it should be what the victims, are the victims satisfied with the process? And then, they would sort of give their own ideas of justice. And so I do plan, as I start working more with the qualitative data, to start looking at how, and that's one of the research questions, is how justice professionals' perceptions of justice overlap with victim survivors' perceptions.
I think that's great. I teach corrections and my students often ask this, about justice and whether it's achieved from the perspectives of not just victims, but those working in the field. So I think that's great. Dr. Johnson, what kinds of follow-up is there? Are you planning for participants? So I think what they're asking is there any sort of follow-up for participants?
Absolutely, yeah. So when I completed the interviews, everyone was asked whether they wanted to be put on a mailing list to be kept up to date on the research findings as they're available. And then same with the survey, when I collected email addresses to mail their compensation gift cards, they were also asked whether they wanted to be put on the list. So actually I sent out the notice about this presentation. And I have a Facebook page for the research project where some participants and non-participants follow. So I post things there. So really just like keeping them up to date on the findings, and, some of them, have interest and just sort of email me articles and ideas. And so I do keep in touch with some of them. Because I think, one of the other justice outcomes that came out very strongly in a few interviews was this idea of community dialogue and just more discussion in the state, more very frank and open discussion about sexual violence, because Alaska does have the highest rates in the country. And so I think there's a hunger for that, to have this ongoing dialogue. And so that's sort of the ongoing relationship that I've been sort of having with the participants.
Great, thank you. Any other questions? Dr. Johnson, what should I search for on Facebook to find the page where you're giving research updates?
Oh, it is, I think it's AK Saki Research. Let me, I should know what our search AK Saki. I'll find it in the next.
They found it. Great. Any other questions? So attendees, you do have the panelists' contact information and now the Facebook group that you can search for if you'd like to keep up with their research. I'd like to thank the panelists for their time and presenting today. This was really interesting research, so thank you. I'm actually going to look at this Facebook page too. It's super interesting. So that is it for this panel. If you are wanting to attend the next panel, please click the link on the CrimCon program to join again. I'm going to close out this panel, and hope to see you in the next one as well. Thank you, everybody.
Bye.
Thank you. Thanks for sharing your research.